Hello everyone. I am very happy to have with me Dr. Sreenath today, and he is a proud achiever of rank 29 in November AIIMS 2017, which is a great performance. Heartiest congratulations, Sreenath. How do you feel about it?
Thank you. I'm feeling great. I'm actually relieved the most.
I am sure you are. Yes.
Yes, ma'am. I'm feeling good. Now I have to make some planning about what to do in future.
Yes.
So I'm here for that guidance also.
That's great, and he's a very humble guy, and that's the reason he's here. He's here to give advice to a lot of his juniors who look forward to rankers like him. Rank 29 in the Apex Institute is tremendous and is worth praise from everyone. Right, and Dr. Sreenath was a TND student with us, is that right,
yes.
Dr. Sreenath?
Yes.
And Dr. Sreenath, we would want to know, because a lot of students join the test and discussion with us, and they would want to know that once you join a course which is a test and discussion, how should they optimally utilize the course so that they get a good rank like you?
Okay. Actually, I thought there are like 3 main steps for cracking the exam. One is consistency, and then it is planning, and then it is belief. So
wonderful.
The main part, planning, DAMS is providing us.
Okay.
So we don't have to bother about that.
So which means you just used to follow the pattern of the tests.
Yes.
Okay.
I used to study for 3-4 days before the exam.
Perfect.
And then give the exam, and then review it for 1 day, whatever has been taught in the test.
I think that's something which a lot of students miss on, revising it after the test to ensure that you are able to
if you keep it for later, I don't think we will retain it more.
That's right.
If we just read it after the discussion, then it's much more valuable, and we'll retain it for a much longer time. So I used to do that, and then I used to give grant tests also very frequently. I mean, every 10-12 days I used to give grant tests since the last 2-3 months.
Yes, so prior to the exams, that is a very good idea. Yes.
And then I gave the AIIMS mock test also, so that I actually had a problem of, I used to sleep in the afternoon since a long time.
And I think a lot of students would, relate to you on that. They have a very twisted sleep cycle, so they would want to hear this out from you.
So I used to sleep in the afternoon for a long time. For 1 hour since a long time.
Okay.
So I found it difficult. When the exam this time was from 2 to 5.
In the evening, yes,
I was quite disheartened. So I thought I'll have to change this. I'll have to adjust my sleep cycle according to that.
Right.
And then I thought I'll give grant test at that time, and I practiced accordingly. I gave grant test from 2 to 5.
Wonderful.
And I gave the AIIMS mock test also from 2 to 5.
So this, I think, which I call is strategizing and knowing your weaknesses. He knew that, the afternoon time he used to keep asleep, and he tried to stay awake, and that too very coherent with what he was going to do. He used to give a grand test in that time. Wonderful advice. I think people out there should please, it is coming right from his heart, and it's a very genuine advice. Something which only somebody who has done it can tell you, and it has worked for him, right?
Yes. Actually, when I gave the first 2-3 grant tests, I did feel sleepy while giving the exam.
Okay.
So then by AIIMS mock and even by CBT, I was confident that yes, I won't be feeling dizzy in the afternoon.
That's great.
I had practiced that out.
Because that's most important. Well. I mean, Dr. Sreenath, you would agree with me that those 3 hours of the exam.
Yes. Our 6 months preparation is being valued in these 3 months.
Precisely.
So, I'm not supposed. I can't afford to feel dizzy at that time.
Absolutely, yes.
So I kept practicing that, and that did turn out well.
Okay.
And I'm happy that worked out.
Yes, I think we are happy as well. It worked out very well for you. That's great. All right. And Dr. Sreenath, we would also want to know from you that especially once you're close to an exam, right, a month or 2 months prior to the exam, what was your strategy before the exam?
I started my revision 2 months. 2 months before the exam.
Okay.
Then I read very less of new stuff.
Very important piece of advice again from his mouth, right?
Because if we read more, then we'll forget more.
So no new things prior to the exam.
I just read what I had read before.
Right.
I just kept reading that.
Okay.
And then in the last 2-3 weeks, 2 weeks I think, I revised the whole syllabus as fast as I could.
Wonderful. Yes.
That won't be foolproof, but that will help me put
because the number of subjects are too many, so you need to do that. Also, since you're talking about these revisions, we would want to know, when you talk about you just stuck to the older things that you did and you were revising, what about the theory and the questions? So what kind of questions, if at all, you were doing them at that time, or what is your advice? I mean,
I used to do previous year's questions. I had done once before, and then I did them again in the last 2 months once. And then I used to review the, in DAMS grant test we have the option of bookmarks.
Yes.
So that I think I made quite use of that, because I marked those bookmarks and then I would review them.
Especially the ones that you did wrong or you find are high yielding. Very important. So consistently what all toppers have been saying, as far as question revision is concerned, close to the exams, they have been doing it only for the ones that they've been doing wrong. There is no point repeating thousands of questions, because that wastes a lot of time and that is not giving you an insight of what you are weak at. So
and if we do a test and we have got like maybe 50 questions, 60 questions wrong, and if we are not reviewing that, then there's no point. That time is waste.
Absolutely.
So we have to review that, and I'll forget that if I review once. So I'll have to do it again and again. So that I think I went back to those bookmarks, and that also helped me a lot.
Amazing. Okay. Right, and also I would want to know from you, the AIIMS exam has a negative marking, and there is a lot of hype about this negative marking. So how many questions did you attempt?
I attempted 193 this time.
193.
Actually, that also I learned from the grant tests only. Because last time in May I had got a rank of 668.
Okay.
And at that time I attempted only 162.
So those were a little too defensive, right?
So and then I gave grant tests, and in the initial 2-3 grant tests I attempted only around that range only, 160, 170.
Because you were comfortable with it.
Yes. But my ranks were coming again in the same range, 700, 600 at that range. And then I started attempting more. I attempted 180, 185. And then I found that my ranks are improving.
Okay.
So I learned that if I have to score more, then I have to attempt more.
Yes.
Being defensive was not my style.
No, it would not actually work with anyone, because everyone if you have to be in the top ranks, you need to go all out and attempt more, and especially this kind of an AIIMS paper where it was not like you don't know it or it's out of the blue. It is, I think it could confuse you between two options, and then you should always go with it.
And many people will attempt more than 185 with this paper.
Yes.
So I couldn't have afforded to
do less.
Yes.
Perfect. And so very important advice again, that you need to push up the number of questions, and you needn't be too scared about the negative, and that too because AIIMS has -1/3 and NEET will have even lesser, 1/4. So all the more reason that don't be too defensive about it. And all right, Apex Institute, although he is an undergraduate from the same institute, he is an AIIMSonian and he's going back to the institute. But we all our other students who want to go aspire to be an AIIMSonian as well and do their post graduation from there. Could you tell them some important topics or what you feel subjects or something of that sort which could give them an edge if they're appearing for the next AIIMS exam?
Okay. With this current pattern, I think images are a big deal for the exams. So
okay, we'll take it slowly, all right? So first he said images are a big deal for the exam. So how do you think could they work up on it? And did you attend our DVT?
Yes, I did.
So as well, can it contribute to the preparation?
Yes, DVT actually definitely contributes to the output. And I think Robin's images are also, if we can get time to just rush through all the images, it's very good. And this time the exam had like lot of images in the questions, images in the answers also.
Yes.
So I don't think without DVT, I think I could have, I would be sitting here. And DVT also, I had some issues regarding
that's what I said. He's too humble, and I think it's a lot of hard work that he's been consistently putting in. And the beauty of it is that he's not just working; he's working with a plan. He knows he has to work on his weak areas, and I think that's what has brought him up more than anything else, which is very nice. Because I think the most important thing a candidate should know is what we are weak in. Okay, so the first thing he said, for any kind of AIIMS exam or any one of you who's aspiring to be there just like him, he said images are definitely something which is important, right? What else?
Then these days they are asking questions like those Foley's catheters and instruments and all those. So it would be good if we can rush through all the instruments in all subjects. Last time they had asked from ortho. This time they are asking from emergency.
Like so they keep switching. They keep doing that. So, right.
I mean, I think we should anticipate this and prepare next time from gynae, from other subjects, ENT.
Definitely, I think we would definitely work on that. So that's great. All right, and also you said you gave the mock exam, and what was your rank in the mock?
My rank was 79.
79. Yes. So do you think that it was useful and it gave you a fair idea of where you stand?
Yes, actually, I gave the CBT and my rank was in the 300s range, 343.
Because the number of students was large.
Yes, and after that I gave the AIIMS mock and I got a 79, so I was
so quite close, 79 and 29, right, in the main exam.
Yes. So I mean, I was quite tensed at that time, and then when I got 79, I thought, okay, this is going to, I mean, this is not that bad. I'll be able to.
You're on the right track,
yes,
and
I'm on the right track, and if I do 2 weeks more of good revision, then I can score within the same range.
That's great. I think
that kept me going in the last 2 weeks actually.
That's wonderful. And you said self-belief is very important, right? And that is something which a lot of people keep missing out time and again because of the the hurdles that they have. But I'm sure everybody has little hurdles in their life, whether it is internship or something else. So tell them something about self-belief.
Self-belief actually, it's not actually just myself, but a lot of people. I mean, this was not an easy job. I had times when I was really frustrated. So I had to keep myself secluded for 6 months. This all comes at a cost. It takes a toll.
So very important to staying focused, right?
I had to limit my social circles. I stayed secluded, but then I had a group of close friends and teachers who guided me, who stayed with me.
That's nice.
And I'm grateful to all of them. Without them, actually self-belief is belief on they believed in me.
That's
so
what true.
That's what kept me going.
And let me tell you, Sreenath, the way because I am talking to him right now, and the way he comes across to me is going to go great heights. He's a person who has a lot of gratitude for everyone. I don't know how much everyone has contributed, but he has a lot of gratitude, and that is something that is going to take you to great heights. That's great. God bless you. And we are very, very happy that you've done well, and we wish you all the best for all your future endeavors. And I'm sure you would have inspired a lot of students sitting there. And just before we end up, 2 things. One, anything, do you want to talk about any of our classes that you particularly liked, or you would?
Actually, when I got the rank of 668 in May AIIMS, I knew I was weak in community medicine. I mean, I didn't give it much thought in the final year also. So I had always been weak in that. And then I thought I'll keep it for later. I'll do it sometime.
That's what we all do, right?
Yes. But then, since I was always weak, I never had I thought I'll do it sometime, and kept it for later. And then I got tensed. I didn't have enough time to. I had to start from zero, community medicine. So I had messaged Dr. Sumer sir about what I can do. So he said, just inform the reception, and then you can attend the regular class along with him. So, and then I attended class. Dr. Siddharth had taught me. So I was weak in all those subjects, and within 3-4 days, it was a 4 days class, and I attended class. And I didn't have to look anything else for CCM apart from that.
That's great, because community medicine is quite a big chunk for almost all exams. So unfortunately, we don't like the subject, but whether we like it or not, it is a part and quite an important part of all examinations.
And I read just his notes after that.
That's great.
I mean, my friends used to read some other books, biostats, and they have some other books, but I just read that notes, and I could do well with those notes. So I'm really grateful to Siddharth sir.
I'm sure he'll be very happy to hear that, because this is the best gift for a teacher as well. When your students appreciate and they think that it was useful, that's the best thing for the teacher. So great. I'm sure Dr. Siddharth would love to listen to this. That's great. And what branch do you want to pursue, or you're not yet decided?
I haven't yet decided actually. I want to talk to Sumer sir also about this.
Perfect. No worries. So I'm sure whatever you take up, you're going to be a very bright doctor, and you are going to be a blessing for the community, right? So best wishes from everybody here at DAMS, and loads of good luck.
Thank you.
Thank you so much.
Thank you.
Perfect.